Late in 2019, humanity received an unwelcomed guest, the coronavirus, otherwise known as COVID-19, as its attendant illness was later named. Had all countries at a loss for how to halt its spread, mitigate its impact, morbidity, mortality, and attendant miseries, the monumental losses in lives and livelihood still depresses the global economy and is catastrophic at the very least on global socio-economic structures. It forever changed all human interactions. The fragile Nigerian health system had no way of withstanding its impact because more resilient and structured health systems could not either. Amidst the turmoil of the most devastating global emergency the world has seen in modern times, Nigeria got a spark of hope. At the heart of Yaba's commercial center, the bustle of the major bus stop, and the hustle of train interchange station, nestles an oasis of knowledge and research, the Nigerian Institute of Medical Research, NIMR, Nigeria's hope and ace against COVID-19. At NIMR, a lot has been done by Nigerian scientists and researchers to tackle some of the nation's health challenges and emergencies within the ambits of communicable, non-communicable, and neglected tropical diseases.
The very first adolescent clinic, that's clinic for adolescents living with HIV in the country, was started in this department and is going strong. So right now we look after adolescents to ensure that they are not lost to care.
So the Nigerian Institute of Medical Research is the first institution in the country to document what is being used in different parts of the country and how far are they effective. And we have done that in several ways by testing the insecticide that is being used to control these mosquitoes. In some areas, the insecticide is working fantastically. It's beautiful. You have 100% control of the mosquito that cause malaria.
Basically, we use two technologies. One is called the Gene Expert technology, and that is the entry point for TB to diagnose TB patients in this country. And then the second one is called the line probe assay technology that looks at other drugs other than the key anti-TB drug, which is rifampicin and isoniazid. It also looks at how these strains are able to respond to drugs that are used for treating patients who are infected with multi-drug-resistant tuberculosis.
Investigations that we carry out here include kidney function tests, liver function tests, infections generally, whether urinary tract infection and some other forms of infection. So we also go into infertility investigation, either male or female, wherein we also look for hormones and some other highly specialized investigations. All this will lead us to investigating disorders in individuals.
Although research has not been appropriately funded to impact national development efforts, research remains central to effective planning and remediating social-economic challenges, the weak national health delivery system, and its services. The breakthroughs and innovations at NIMR make a strong, indisputable case for funding medical research.
Perhaps the major innovations that we've done during COVID this year is the development of what we call the NIMR kit, which is a molecular assay kit that is used to diagnose COVID-19. It's akin to PCR and it works at a very short period of less than 40 minutes. This kit was adapted to an isothermal machine. Ordinarily, the diagnosis of PCR is made by COVID-19 is made by PCR, and the PCR machine costs about $50,000. Is this 50 million? About 50 million naira. That machine cost us about 4-5 million, and it can do 16 tests under 40 minutes. The beauty of it is that it can be taken away from the big laboratories. Secondary and tertiary care levels can acquire them, and they can run their tests within their hospital without looking for the big NCDC lab. It can also be taken to the field to use for researchers. So hard to reach areas and remote areas, the villages where these tests are not available, can actually benefit from the test kits that we have developed, because these can be taken to the villages and they can get their result within 40 minutes of taking the sample.
And then also we had to also start producing our own viral transport medium. So these samples that are collected, they collect them in a certain medium, and that's the viral transport. We prepare the medium here. In fact, we have supplied at the national level. NCDC has purchased some for some states. Some states have approached us. We have been producing, and for our site here, we produce everything we use. And some other private organizations have also purchased some for their own use.
We started developing templates for any kind of vaccine, and so the COVID-19 outbreak came up, and we had to take a course towards the COVID-19 vaccine development. What we have done is that we have a template for peptide subunit vaccines. But you know, there has been fears of some of these viruses, you know, gaining back life once they are injected into the human system, and so that came about the peptide subunit. So the peptide subunit is not working with the whole virus structure or the whole viral structure. We are just working with the peptide, or the part of the virus that initiates immune response, so that we are not injecting the whole viral particle into anybody for safety reasons, and also being able to elicit immune response so that it can protect, peradventure, any vaccinated person is exposed to the real viral agent.
We have NIMR Biotech Incubator, we have NIMR Biotech Oven, we have NIMR Biotech Bogus Centrifuge, we have NIMR Biotech Hematogrid Centrifuge, we have NIMR Biotech buffers, we have buffers we are producing, we have a lot of things we are producing. We have here a modified genotype machine. It's quite different from other machines we have been seeing elsewhere. This machine has the capacity to cause separation of red blood cells within 3 to 5 minutes. Other ones, that the imported ones, you can think of having separation within 30 minutes. But here, what we do is we have the separation, what we call genotype. So when people want to get married, they have to test their genotype, do those basic things. NIMR is providing solutions in that area to make sure that people don't just marry anyhow. They have to be tested so that they don't bring out sickle cell anemia patient into the population.
We have about 7 products now that we want to test in humans. We have one for diabetes, one for hepatitis, arthritis. We have one. There's one for eye drop. I think that's the eye drop. We've done a preliminary study on it and found out that it's good. It takes care of the redness of the eye, itching of the eye. So we want to do a larger study on it. Then we also have one for prostate enlargement. So all these ones we want to do in humans for now.
Pursuant to its mandate, the Nigerian Institute of Medical Research, NIMR, undertook research efforts that have produced landmark results.
One of the principal ones is that you know, the advent of HIV/AIDS, and when AIDS was almost like a death sentence, NIMR was among the institutions in the world that conducted research that shows that HIV/AIDS could be managed with less expensive drugs. And that's actually led to the global crash of the HIV drugs and the improved access to HIV globally.
Results and innovations that can potentially transform the medical, diagnostic and treatment space, especially in the wake of the COVID-19 pandemic.
We've been doing this testing since February, and we've known some of the issues associated with it. And one of the key things we thought should be able to help us increase testing all around the country is to decentralize the testing. Initially, it was like a few labs. I felt that about 3 or 4 labs in the country that were testing for COVID. And now, NCDC have hopefully increased, and there's one in every state. But beyond one in every state, it should be able to go down to as much health facilities as possible, because there are situations where people may have health emergencies and they will need to be tested so that they can know what is wrong with them. And that is where this assay comes in play.
These homegrown solutions, when appropriately deployed, hold promises to transform the health landscape not only in the country but also the sub-Saharan Africa for their resilience, similar applicability and competitive cost advantage.
When the COVID-19 pandemic started and we had our first case in Nigeria, the DG, although after the DNA extraction kit, we already had it in plan that we were going to make an RNA extraction kit for the institute. But because of COVID-19, it's kind of hastened us making our own RNA extraction kit, which we did. And by June this year, it was launched. And I must say that it has been validated in a couple of sites, and it did very well. At least we have over 90% correlating with other commercial kits that you get abroad.
It has made the institute to be a hub of learning and acquiring research skills for conducting molecular-based projects at undergraduate and postgraduate levels.
From its modest beginning in 1920 as the base for the Yellow Fever Commission for West Africa, to becoming the seat of West African Council of Health, and then the Nigerian Council of Health at independence in 1960. NIMR has come a long way indeed.
This is the Central Research Laboratory of Nigerian Institute of Medical Research. The reason for setting up this unit is to have a place where certain specialized equipment can be located. Certain specialized equipment can be located that serves researchers and scientists working in this facility and in other facilities in Nigeria.
NIMR is the foremost and oldest organization for research in Nigeria, a pride of place it fiercely maintains by undertaking research efforts that are continually producing innovations and landmark results.
It is the foremost medical research institute in Nigeria, and all issues that has to do with medical research in Nigeria are supposed to be tackled here.
So we have a 3-pronged mandate to conduct research, do capacity development, and provide service.
The organogram of the institute, it has 5 research departments that conduct research into disease of public health importance in the country.
Under the strategic leadership of its Director General, Professor Babatunde Lawal Salako, and with very little funding, a lot has been achieved by Nigerian scientists and researchers. these achievements have made a significant impact on the medical research landscape of the nation.
When I came in as Director General a little over 4 years ago, we visited the South African Medical Research Council and had some chats with them for about 3 days and did a talk around their facilities. And one of the things that we brought back home was the idea of creating an innovation unit. So we have what we call Research, Innovation and Management Unit. When we came back, we created that, and that had been in the forefront of ensuring that our research is more of translational research, meaning research that has direct applications to public and health delivery use.
We got RNA extract from the index case NCDC brought for us, and within 3 days we were able to sequence it. So we were the first to actually lodge the sequence, on the gene bank. And then after that, we have been, NIMR was now enrolled in the National Network of Labs.
Professor Salako has also opened up NIMR for collaborative research within and outside the country.
When the pandemic started and we got the first case in Nigeria, we thought, how can we be of help? Because at that time, there were very few laboratories and testing centers. And so we decided to work with an NGO called Life Bank, who went about to seek for funds. I believe we were able to get about 30 million naira to kickstart that drive-through center. Now, the drive-through center has been done in, I think, in Germany, in the US, and a few other countries in the West. And so we just adapted that and modified it. Rather than being a drive-through only, where people just drive in and get the test done, we also created a walk-through. So that as you can drive into the place, you can also walk into the place. But what we did was to ensure that first you have to be registered on our website, and you have to be invited a particular day and time for you to be able to come for the test. And if you are not invited, we won't conduct the test. So that has made the place very, it hasn't made it rowdy, really. And people just walk in with their invitation, they get tested, and they go, and it's been for free.
We also collaborate with a telemedicine organization called Mobi Health, where doctors, nurses, health professionals can relate and consult with individuals or patients remotely. So what we did was we created a short video on how to collect the sample, and this short video is meant to be a form of training video for the person that wants to test. So you want to test through the DIY. The first thing is that register on our platform. After registration, and indicated that you want to test, you want to collect the sample yourself, and then we send the video, the short video to you, and then at the same time on that platform, a trained personnel, could be a doctor or a nurse, is actually at the back end communicating with the individual that want to test and put them through any question that may arise from the video. And then once we are sure that you have this information, while you are getting through the training, the order is made through a logistic company that will come to the institute, pick the sample pack. The sample pack is not here at this point in time, that has been designed for that purpose. And the sample pack is taken to the individual's end, the house, the office, wherever you have chosen for us to come and give you the pack for testing. And within just 2-3 minutes, because they rather wait for the person to finish the sample collection. So the person goes, the mama goes to the room or whatever, collect the sample, and then bring it out again and send through the rider back to the institute for testing. So this one is purely a contactless process, where the person does not come out of wherever they are in the comfort of their house, their offices, their their comfort zone, and then they get the sample tested, and then they send the sample back to us for analysis. And once the result is, and again, in all of these processes, both the drive-through, the walk-through, and the DIY processes, none of the processes encourage result collection by hand. These results are also sent electronically to those individuals that come for, that are interested in testing for COVID-19.
This is one of the few labs where we do actual culture of this organism. My collaborators that are gastroenterologists, I have them in Luth, I have them in Lasut, I have them in UCH, I have them in Ife, I have them in Benin, and I have them in the north, just one of them from the north. But basically what they do, if they have issues of treatment failure, they usually send patients to us here to do the actual culture so that they could see if they could improve or change the treatment regimen that they use so as to improve the health and well-being of people that have peptic ulcer diseases.
NIMR has stood up, NIMR has stood its ground that in the next 3 to 5 years, anybody that wants to set up a laboratory or having an existing laboratory can walk into NIMR, and NIMR can give you all this equipment. With a very meager sum, you can have all these things instead of saying I want to bring millions of naira. Within less than even 200,000 or maybe 150,000, you can have all this equipment to yourself.
However, for NIMR to optimize its research potentials, issues around funding and an enabling environment must be addressed.
Our conversations with the Nigerian Institute of Medical Research started about late July, August. As I said earlier, one of the main priorities for our philanthropy is research. We believe very strongly in innovative research that is able to address key critical solutions to issues that are impacting us, and particularly research that is done indigenously, because we have the talent, we have the human capacity, and we're really what we can use to be able to solve the different issues that we have. And so we had been, of course, aware of the Nigerian Institute of Medical Research for years. They are, for us, one of Nigeria's pioneer research institutes. And we started a conversation with them to even understand the different researches that they were doing around the pandemic, particularly to address and curbing the virus. And they presented to us, particularly the DG, Professor Salako, presented to us an idea that they had to do a test, a prototype test that could eventually be used to test infection rates. We found this very interesting, and upon considerable conversations with them, we decided to commit to provide grant support of 20 million naira to help Professor Salako and the team led by Dr. Chika to be able to do a prototype version of this test.
So it is so crucial that countries, particularly with big population like Nigeria, must do something in that area. Say, look, we have to be self-sufficient in some drugs, in some vaccines, in some products that we shall need to improve our existence, our well-being. So it's not everything that, oh, we have money, we're going to buy, we're going to buy. Let's start establishing facilities, funding research, and making things work for us.
Following recent global health challenges and given the fact that Nigeria remains the destination of global investments and human migrations, the influx of human and sundry traffic predisposes Nigeria to the attendant effects of these human activities. Some of NIMR's innovative equipment can be deployed to rural health care centers and to the points of entry at a low fraction of the cost of the foreign ones, a saving in hard-earned forex. The deployments will activate the nation's guards appropriately and forestall any unforeseens.
But the good thing about the COVID-19 pandemic, or it has been an eye-opener that research is not all about you doing basic research. We must be able to translate it into a product. That product at the end of the day is going to, help humanity. Because now with what we are developing in-house in NIMR, we are looking at cheaper tools that we can use not only in our environment. It will save the government, foreign exchange, the much needed dollars that we need to buy. They can get these things locally.
So the implication is that you don't need to imagine someone in Atepe in Lagos coming, they need to do a test. And they are sending the person all the way from Epe to Yaba in Lagos. So, but if they have this, they can do their test. And the great thing about the test is that it can do from 1 to 16. Even though we tell you that in each test, you try and put positive and negative, it can do like even just one test. So that makes it fine that no matter the number you have, you can manage it and it will still be cost effective and do the small number of tests. So if you have it in facility and you just have one person or 5 people in a week, you can still be able to do it so far as you keep your reagents very well.
Probably if we're able to bridge more of the gap between the researchers and the policymakers, because our researches are supposed to inform policy. You know, if the policymakers and the researchers are able to come together more, well, I'm very sure we'll be able to make a lot more impact in informing health policy in the country.
Well, the way forward is to create a very strong advocacy to enhance the priority for health research by various governments, the federal and state governments of Nigeria, to be able to increase this government subvention for research. We need to carry out this advocacy to our National Assembly and then to the Ministry of Finance and to, you know, various government functionaries.
In the pipeline, we are producing again what we call the RNA sample release solution. Now this will obviate the need of using the RNA extraction kits such that it shortens the process of diagnosis of COVID-19 itself, either by our own NIMR test that works less than 40 minutes or by the conventional PCR, whichever one is going to shorten that process. So you can in fact shorten even our own 40 minutes much more to about 30 minutes. And we hope that when that is out, it will also be something that will improve the capacity of our laboratory and our researchers to be able to test as many people as possible.
Funding research remains the wisest option to nations hoping to develop. Implementing the outcomes of research undoubtedly enhance their value through the returns on investment.
So I can tell you that we're very pleased with the support that we've invested with NIMR and the partnership. We've seen the value of investing in NIMR, and we've seen the work, the commitment, the diligence that they have exhibited all through, before, during, and that. And we see our work with NIMR as a long-term partnership. Even beyond, because outside of COVID, there's so many other things that we have, and there's so many other things that NIMR is also working on. So we definitely see this as a longer-term partnership, and we're glad that we're able to have started a foundation to something that will be of larger benefit to the society as a whole.
Research is an investment, and opportunities exist therein. Patenting innovations and breakthroughs from research is revenue indeed for government and the research institutes.
So we continue to talk to government. We know government tray is full. We know there are competing needs, but we also want to say that health research and supporting health research is a sure way of improving the community's health, of getting strong and healthy public workforce, and of course can translate to economic prosperity to people, especially if innovations, patents and discoveries are able to come out of this.
Research puts us in a place of preparedness and even of power in any eventualities. That's the wisdom in funding research.